The way we do medicine right now is not working.
These people don't come with a single medical problem. They come with lots of problems, 6 or more chronic illnesses.
Patients who are most complex tend to get their health care frequently by utilizing the emergency room.
Sometimes 20 times within a month, sometimes 6 or 7 times within a month.
We needed to look at the population for Virginia Coordinated Care and determine a new method in which to intervene and show improved care for the population.
Once I got really sick, I think I was at work one day and passed out. And that's when I found out that I had diabetes. That following Friday, come to find out I had osteomyelitis in my toe. I went and had bypass surgery done. Then I got another doctor telling me, okay, we need you to go ahead and amputate your leg. That's when my life really started to change.
I couldn't even do things for myself. I couldn't bend down and tie my shoes. I could hardly walk.
I couldn't do a lot of things. Hold a spoon. I couldn't feed myself. My self-esteem was very low.
I felt depressed, stressed, all the types of emotions that you can have when you get sick.
I didn't know if I were gonna make it.
In the complex care clinic, the patient gets to come in and they sit in their exam room and they're seen by so many different people. And their plan of care includes, medications and food, nutrition counseling. And I tried to do a holistic approach and look at their life and try to connect them to the right resources or provide the right services.
I felt like I was sitting in the middle and it was just a circle of great support and help around me that I could utilize.
I think it takes a community to take care of patients. If you don't have this team approach and figure out really what's going on beyond their medical diagnosis, you're not going to be successful.
Everyone should care about this program and the care of a complex patient because it decreases the cost for everyone and improves the health of everyone.
There's just no comparison to going to the ER when you're seen for 5 seconds, by a doctor and you're seen by your nurse. And here you're in a room and it's a very intensive visit with lots of different professionals from different areas. It would take that patient all day to go to a nutritionist and then go to a doctor, go see a social worker at social services. And in complex care, you really get it all in one visit.
If we look at just costs, that's one part of the story. It's about the quality of life as well.
Since I have been in the complex care clinic, my health is great. I'm doing much better physically and emotionally.
I can drive again. I can basically take care of myself again. When you got your own child look in your face and saw what you went through and was there with you, and now you can go out there and play with her and run around and just do the things that you used to doing. Yeah, I may have lost a limb, but in the end, I won life. So I can't ask for nothing better than that.
To be able to be back here and smiling and happy and with no worries and just feel good about yourself all the time now, this is happiness for me.
Several years ago, my mother, at the end of her life, was suffering from congestive heart failure, diabetes, hypertension, end-stage renal disease. She had a colostomy, post-colon cancer. Had she had a clinic such as this, life may have been much different than how it ended. And it would have been different for me as a caregiver to her. So I truly believe that this clinic has the ability to be replicated with other populations, such as the Medicare population and other complex medical populations that we serve. That's my belief.
Through the success and the good outcomes we've seen, we've realized that this can be done anywhere. This can be done in other hospitals, other clinics. To think that you can start those clinics anywhere in the country is very exciting, and I think hopefully a positive future for healthcare.